Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello. I am welcoming you to Body in Balance. Those of you that have been following me for a while, I'm going to apologize to you from the beginning. I have just been having a crazy last 2 weeks of my life. I have finished my 1-year assignment in the ear, nose, and throat clinic in California. And so I will be moving back to Virginia. So from coast to coast, I have been rolling. And so I thank God for this actual time because it gave me an opportunity. This is like my, coming up in January will be my 1-year anniversary for my podcast. And so thank you. Those of you that have been following me, I want to apologize for, like I said, a couple of weeks of not being there or not presenting anything new, but I have been blowing up my TikTok. I will say that I'm kind of like 6'7" on my YouTube, but once I fly into Virginia, I will get it together. I will have it popping. It will be on and popping. I will be in a settled place back in my studio in Virginia, and we will get started with information for you all to see. So right now, I'm going to jump right in. Today's title is Something is blocking my breathing. Something is blocking my breathing. We just talked about a couple weeks ago fall allergies and how that can cause some nasal congestion. That's if the turbinates are swollen. I want to talk about something new, that is nasal polyps. So we're going to just get into how they are developed, where they usually develop, what causes them, explaining about them. We'll talk about symptoms, and you will know what's happening with you or a friend. If you have a friend, you may be able to share this with them and help somebody out. But I want to be able to give you the information. So we're going to talk about treatment and different approaches. I have also posted a surgical procedure on how this is removed. Now, I did not put it in my video here or on my podcast because I didn't want them to block it because it was too gory or something like that. And I need you to be prepared because it's going in the nose with a scope, and it shows how the microdebrider just kind of eats up at those polyps like a Pac-Man game, like the Pac-Man game. All right, so let's get started. What we're talking about on our agenda, I just ran through with you. And so we're going to skip on that. And let's get this bigger so you guys can see what's happening. Nasal polyps are soft, benign, meaning they are not cancerous lesions that grow inside the nasal passageway. Now, what you're looking at, this is what's called the coronal view. Now, some of this may be a little deep for you, but my audience is on point. And so I know that you guys love information. You like to know about stuff. So I give you the real. So what we're looking at is what's called a coronal, that's right face to face, looking at them. If you can see the eyes there on the side, those top sinus areas, or that top cavity above the eyes, is the frontal sinus. Between the eyes is called the ethmoid sinus. Back deep behind the eye, which you can't really see on this image, is the sphenoid sinus, which sits behind the eyes, the sphenoid sinus. And then at your cheeks is the maxillary sinus. Now, when you look, you'll see the image has the point of the nose, those two little dark circles, that's the opening of the inside of the nose. So if you look at those openings, sometimes people grow polyps that hang out and it looks like two peeled grapes hanging out of their nose. And those people have a difficult time breathing. So that's what impacts their breathing. The larger those polyps are, the more blockage you will have, because airflow should flow freely through that nasal passageway. So what are some of the characteristics or some of the things that can occur? I want to go back and say to you, we looked at the coronal view in the last slide. This is the sagittal view. I'll say it again. It is the sagittal view. Okay. So polyps look like peeled grapes that hang off like teardrops within the nasal passageway. They appear kind of either pink or grayish, depending on how big they are, how much blood flow is in them. They may look rather gray looking. And if they're pale. Now this lets a provider, a specialty provider, most of the time your ear, nose, and throat people are going to know the difference between that and a nasal cancer or a nasal lesion that is not benign. Remember, the word benign means it's not a non-cancer, that it's a non-cancer. Now, they occur usually in a cluster, or they can come as one big nasal polyp. So this is the coronal view of a CT scan. So it looks at the ethmoid sinuses, the frontal sinuses. You can see the maxillary sinuses. You cannot see that sphenoid sinus because it is not a side view where you can look at it. Okay. So those polyps normally grow wherever there's black space that is open and that's supposed to be open. The black space means there's air. The gray, like those gray, thick commas in the bottom part of the nose on this, that's your inferior turbinate. That's the turbinate that's there that helps to filter the air and keep out dust and dirt and things like that, pollen. But when it gets irritated, those things kind of plump up like ballpark franks. When ballpark franks plump when you cook them, those things will plump up and it's hard to breathe. So if they swell up, and it's hard to breathe, and you've got an obstructed piece of tissue in there, a polyp, It's really difficult to breathe. So what usually causes this? Inflammation. Inflammation is caused by allergy. Allergic reactions will trigger an immune system problem, which makes you start having issues with swelling. Chronic infections, like chronic sinus infections. If you're always getting sinus infections because you have allergies that cause your inferior turbinates to swell up, and there's no free flow of air through the sinus passageways and through the nasal passageway, you'll get inflammation. There's also anatomical variants. So if mom has a crooked nose and a deviated septum, which the septum is where you see that dotted line going through the nose, that is the septum, that dotted line. If you look at this, if it's moved to the right or moved to the left, because both sides of your nose should have the same space, but if it's moved to the right or moved to the left, because the way you came through the birth chamber, it could be your child bonked you in the head, or the dog jumped up and bonked you in the nose, or you got into just a good old-fashioned good bar fight and got punched in the face. That could cause a problem with your nasal septum also. Now, some associated things with nasal, or associated disease processes with nasal polyps, is asthma. And like I talked about, allergies. Another one is something called cystic fibrosis. Because I have a weekly podcast, we'll talk about cystic fibrosis at another time. But it's just a mechanism that makes you produce very, very thick, almost sticky like glue, clear looking mucus that causes a lot of inflammation. We've talked about these other things in the past, asthma and allergies, so we're going to move on. Some common symptoms with nasal obstruction. Well, you feel stuffy. You feel blocked up. You feel like you can't get air through there, and you really can't because it is obstructed, the passageway. You'll have a loss of sense of smell. There are nerves that come out from the top of the skull, at the base of the skull, right by your forehead. It looks like a spaghetti sieve. You know how you boil spaghetti? When you boil your spaghetti and you take that sieve and put your noodles in there, and your noodles kind of hang through the holes as the water's coming through, and the noodles will poke through. That's the way the base of your skull right in this area looks. And those noodles would represent the nerves that go through there. Well, if you have a lot of polyp tissue, what it does is it takes, I'm going to show you this cord. This cord would represent one of those nerves. So if there's a polyp in there, squeezing on that or putting pressure against that, and it squeezes, that pressure will slow down the impulse, the nerve impulse that's going through that rope, that nerve. And so when it's blocked up, then you can't do what that nerve is supposed to do, help you smell. So you lose your sense of smell. Now, you can get your sense of smell back if we as providers can help you to shrink that inflammation and that tissue, or you do surgery and remove it. It's really incumbent upon that surgeon to try and do his best not to disturb any of the normal mucosa, just to remove the inflammation. And that way you may be able to have your sense of smell restored. Okay, let's talk about the different things. We've done this before. Those of you that have followed me, if you don't follow me, I would suggest that you subscribe, that you like and subscribe, and you'll be hit up. I'm going to tell you, why don't you just go ahead and click that subscribe button right now so that you can be a part of this community, and you will be able to learn different things, because I'm going to tell you now that insurance is going up and things like that, there's a lot of little tips that I can give you on here that will help you with some of your issues that you have with your ears, nose, and throat. And I talk about some other health issues, but I am a key ear, nose, and throat person. So there's a lot of juicy things that you can take and utilize. You can share it with your friends and help them. That nasal sinus rinse, that Neomed rinse kit, it's a bottle. And I'm going to, I think on one of my the spring allergy video that I did, or podcast that I did, go back and look at the spring allergy one, because what I did was I put a video so you could see how to utilize that. What you'll do is put the saline pack in the bottle, and then you'll put distilled water to the dotted black line that's on there. And then just let me shrink this. I just want to show you. Just put the nozzle, that black nozzle, just slightly right to the edge of your nose and gently squeeze it. Don't try to power wash your nose. Don't squish it like that. Just gently squeeze and let the water flow in and flow out. Tip your head down. Put the nozzle there and gently squeeze so that the water will flow in and it'll flow out. It may flow in and flow out the other side. I can tell you this, if you have polyps, it's not flowing out the other side. It probably will barely get into the front. But a lot of times we give you that particular rinse and we will use a steroid. So you will put the steroid vial down in the bottle. You'll put the saline pack in the bottle, and you'll put your you'll put your distilled water there and rinse half on one side. And once you rinse that put that half on one side, you do like your grandpa taught you on the porch, close off that side that you rinse. So if you've rinsed this side, do like your grandpa taught you on the porch, close this side off and blow so that, hunk or whatever is going to come out of there. And then you do the same thing on the other side. That helps. Let it drip for a little bit, close off like your grandpa taught you and blow, okay? And that will help to clear your sinuses. If you are prescribed budesonide, that steroid, if you're prescribed that by your doctor, then put that in the bottle. If they don't prescribe that, then what you do is rinse your nose first. If you have polyps, they rinse your nose first and then use Flonase or fluticasone. You can use Nasacort or triamcinolone, or you can use budesonide or Rhinecort. One of those three, and it just depends on what is on sale that you can find. Any one of those is good. Now, let me say this, caveat to using Flonase. Flonase has an alcohol base. The other two do not have an alcohol base. So in the wintertime, Flonase can cause nasal bleeds, can cause nosebleeds. So be careful with that. It can cause nosebleeds because of the drying. The other thing that can occur is you can get headaches with Flonase. I have seen a lot of reports, and I've had some patients. I myself suffer with headaches when I use Flonase. And because my migraines are so bad, I definitely do not want to start anything that's going to cause my head to hurt. So if you're a migraine patient, I would shy away from Flonase because of that. Some people are too sensitive to that alcohol base that's in there. It is a good medicine for those of you that can use it. All right. Now, Allegra or fexofenadine, Claritin or loratadine, Zyrtec or cetirizine. I gave you the brand name and I also gave you the generic name. The reason I gave you the generic name is because if you see the brand name, look for the generic name because it's going to often be $3 to $4 less than the brand name. Okay. All of those are good medicines. However, Allegra or fexofenadine, Claritin or loratadine are really truly non-drowsy. They don't cause drowsiness. Cetirizine or Zyrtec can cause drowsiness. So I would suggest if you're going to use it, then use it at bedtime. If you notice that it doesn't bother you, then don't worry about it. But I like to kick knowledge everybody's way so that you can glean something from this podcast. All right, let's go on to the next slide. Now, another medicine that's out there are the biologics. And let me share with you about those. They're not really new on the market, but they're newer than Claritin, Allegra, Zizal, Zyrtec, and taking prednisone. But these help to fight the inflammatory process. There's a whole process that takes place. So once whatever enters, once a piece of pollen or dust or a mold particle gets into your nose, it gets onto the tissue. It causes another problem. It makes histamine come up. And then there's other chemicals that come up. Well, then there's chemicals that cause inflammation. They literally cause inflammation. What these medications do is they target that. Now, why can't I just get this right away? Well, you shouldn't use it if you're not having an inflammatory process, and we're talking about polyps. Now, you may have heard Dupixent. You may have heard Dupixent commercials. You may have heard Nucala commercials on TV. Those are only given by ENT doctors for people that have severe polyps. Now, in the medical field, not everybody gets those. Sometimes they wait till you've had surgery, and to prevent you from having another surgery, they may start you on these. Other times, there's another school of thought where they will start you on these and then do the surgery and keep you on this to prevent it. The issue with it is it does target inflammation in a certain way. It does have pretty low side effects. And it can be helpful if you have severe allergies that cause asthma and that also cause skin conditions like severe eczema. So what these medications work real well. The problem is they're extremely costly, very costly, and may be difficult for you to maintain if you're trying to pay out of pocket. There are programs that these companies have if your doctor provides this medicine. You may be able to contact the company about it. However, if they are not providing you any support, the medicine is, like I said, extremely expensive, but Dupixent is given twice a week or twice a month. I apologize. That's twice a month. And the Nucala is given once a month. Now, sometimes you can take Nucala and it doesn't help you because the type of inflammation you have is different and it will respond to the Dupixent. And then there are times where you can be taking the Dupixent and you don't respond very well, so they'll switch you over to Nucala and that will work better. That's because there's no way to really see what which inflammation you have. Now, if you look down in the bottom left corner, and I'm about to wrap up, in the bottom left corner, you'll see all that area where I showed you initially was supposed to be black is now all gray. That means polyp tissue has gotten all throughout this person's sinuses. So this is basically how they sound, like they have a cold real bad. They sound like they have a cold constantly. So they talk where it's real nasally and it's something stuffing up their nose. Those people that talk like that are having problems because their CT scan probably looks like this because they have so much inflammation. How would we treat this? We would treat this with a surgical approach. So they use an endoscopy to do the surgery. I'm not going to go into it because not everybody has this problem, but for those of you that do, you may want to go to my YouTube page. I suggest you subscribe, like hit that subscribe button and go to my YouTube page and you'll be able to see the video. I'm going to give credit to Dr. Vic Veer, V-I-K, last name V-E-E-R, Vic Veer of Royal ENT Hospital, who is an ENT surgeon. And so I'm giving him credit for the video that's on my channel so that you can see how they remove these polyps and do this surgery. All right. So in conclusion, I just want to wrap up by letting you know that polyps come from chronic inflammation. There's different health issues that can be associated with it, which is asthma and allergies. Cystic fibrosis is another. We'll talk about cystic fibrosis on another video or podcast. And then early diagnosis is real important because if you can catch the polyps when they're smaller, then we can treat them with the things that are medical, like I suggested to you. Those will help to shrink and change your life. Really, it does. It helps you sleep better, helps you breathe through your nose better. It keeps your mouth from being so dry. Your mouth will be dry because you have to keep your mouth open to be able to breathe. It doesn't make it miserable when you're trying to eat, because when you eat, you have to close your mouth to chew. And when you're closing your mouth to chew, you can't get air in. And it makes it so hard for you to eat, breathe, sleep. So all these things, you want to go see your doctor. And if that's a problem, then start these medications that are easier to get to than the one that I talked about, the biologic, okay? The treatment for this are the medications we talked about, the antihistamines, which is Allegra, Zylol, Zyrtec, Claritin, cetirizine, all of those. And then biologics, which is Dupixent, Nucala. I think there's a couple other ones out there. I didn't get into those. And then surgery as an option. I have brought you some good information to help you, those of you that have been having trouble with your sinuses, okay? And that is my conclusion. I hope that you have grasped something for your health. Hopefully, your horizons have been enlightening.